We hear the word anxiety all the time before a test, a big presentation, or even in traffic. It's a normal human emotion like happiness or sadness. But is anxiety just a feeling, or can it be a real illness? This question matters. It shapes how we see ourselves and others, and how our healthcare system responds. The confusion comes from the fact that everyone feels anxious, sometimes making it hard to know where normal ends and illness begins. Some dismiss severe anxiety as weakness or a lack of willpower. But this creates stigma and stops people from seeking help. Understanding the science behind anxiety disorders is the first step to breaking these harmful ideas. In this video, we'll explore where the line is drawn between normal anxiety and a clinical disorder. We'll look at what anxiety is, how it's diagnosed, what causes it, and how it's treated. Our goal: clarity, not opinion, just facts and evidence from decades of research. Let's start by defining our terms. We'll separate everyday anxiety from clinical anxiety disorders. We'll examine the biological, psychological, and social factors involved. By the end, you'll have a clear, evidence-based answer to the question, is anxiety a real illness? The answer is more complex than yes or no, but it's grounded in medical science. This understanding can change lives by fostering empathy and promoting effective care. So let's begin. We'll start by looking at the difference between feeling anxious and having an anxiety disorder. This distinction is crucial for understanding, support, and treatment. Let's dive in. Anxiety is a natural human response, your body's internal alarm system. It evolved to protect us from danger, triggering the fight-or-flight response. In modern life, this system activates before interviews or speeches, temporary and often helpful. But a clinical anxiety disorder is different. The alarm system becomes faulty, going off at the wrong times or never shutting off. The fear is persistent, overwhelming, and often triggered by non-threatening situations. For someone with an anxiety disorder, the world feels constantly dangerous. This isn't a choice, it's a malfunction in the brain's wiring and chemistry. The key difference is impairment. Normal anxiety doesn't stop you from living your life, but a disorder does. Pathological anxiety causes distress and interferes with daily functioning, work, school, relationships, and enjoyment. The anxiety is out of proportion to the situation and lasts for weeks, months, or even years. So, we have two concepts: the universal emotion of anxiety and the medical condition of an anxiety disorder. Confusing the two leads to stigma and misunderstanding. Recognizing anxiety disorders as legitimate health problems is the first step toward effective diagnosis and treatment. The brain, like any organ, can become unwell. Understanding this distinction helps us support those who need help. It's not about being tough enough. It's about recognizing when anxiety becomes a medical issue. This awareness can change how we respond to ourselves and others. It's time to move past old misconceptions. Let's look at what anxiety disorders actually look like in real life. The symptoms go far beyond just feeling nervous. They can affect every part of a person's life. That's why getting the diagnosis right is so important. Let's see how anxiety shows up across the lifespan. Anxiety disorders show up in physical, emotional, and behavioral symptoms. Physically, you might have a racing heart, shortness of breath, dizziness, or muscle tension. These are the body's fight-or-flight system stuck in overdrive, exhausting and sometimes mistaken for a heart attack. Emotionally, anxiety brings constant worry, intrusive thoughts, and a sense of doom. It's hard to focus, make decisions, or remember things. In children, anxiety might look like stomach aches, clinginess, or tantrums. Teens may withdraw, see grades drop, or turn to substances. Adults often worry about work, finances, or family, and may avoid social or professional situations. Older adults might focus on physical complaints like pain or sleep problems, making anxiety harder to spot. Symptoms can look different at every age, so recognizing them is key to getting help. Anxiety isn't just in your head, it affects your whole body and life. Understanding these differences helps ensure everyone gets the support they need. Early recognition can make a huge difference. Next, let's talk about common mistakes in identifying anxiety. Diagnosing anxiety isn't always straightforward. One common mistake is diagnostic overshadowing, when symptoms are mistaken for another condition, especially in people with autism or developmental disorders. Behaviors like social avoidance or repetitive actions might be seen as part of autism, but could actually signal anxiety. Missing this means anxiety goes untreated, making life harder for the person. Anxiety can also be mistaken for ADHD, especially in kids who fidget or can't concentrate. Sometimes cultural or gender biases get in the way. Men may describe anxiety as physical symptoms, while women are more often diagnosed. Overcoming these pitfalls requires careful, patient-centered assessment. Clinicians must look deeper and ask the right questions. Getting the diagnosis right is crucial for effective treatment. Awareness of these mistakes helps us support everyone, regardless of age or background. Now let's look at other conditions that can mimic anxiety. Anxiety symptoms aren't unique to anxiety disorders. Many medical and psychiatric conditions can mimic them. Hyperthyroidism, heart conditions like SVT, asthma, and even low blood sugar can all cause anxiety-like symptoms. Depression and substance use can also present as anxiety. Withdrawal from alcohol or sedatives can trigger severe anxiety. Before diagnosing an anxiety disorder, clinicians must rule out these other causes with a thorough medical workup. Some anxiety-related disorders like OCD or PTSD have their own specific features and require different treatments. Diagnosing anxiety is like detective work, gathering clues from medical history, symptoms, and life events. Only by identifying the true cause can the right treatment be given. This careful process prevents misdiagnosis and ensures people get the help they need. It's not always simple, but it's essential. Next, let's break down the different types of anxiety disorders. Each has its own unique features. Once other causes are ruled out, the next step is to identify the specific anxiety disorder. Generalized anxiety disorder involves excessive, uncontrollable worry about many things, lasting at least 6 months. Panic disorder is marked by sudden, intense panic attacks and fear of having more. Social anxiety disorder is an intense fear of social situations and being judged. Specific phobias are irrational fears of particular things like spiders or heights. Diagnosis involves detailed conversations, questionnaires, and understanding how symptoms impact daily life. Each disorder responds best to certain treatments, so getting it right matters. Accurate diagnosis leads to targeted, effective care. It's not just about labels, it's about finding the right help. Now let's talk about how anxiety disorders are treated. Anxiety disorders are highly treatable. The main treatments are psychotherapy and medication, often used together. Cognitive behavioral therapy, CBT, is the gold standard, teaching people to change negative thought patterns and develop coping skills. Medications like SSRIs, Prozac, Zoloft, Lexapro are safe, non-addictive, and effective for many. Benzodiazepines can help in the short term, but aren't for long-term use due to dependence risks. In emergencies, like severe panic attacks or thoughts of self-harm, immediate medical attention is needed. The emergency room can provide fast relief and connect people to ongoing care. Long-term management is a partnership between patient and healthcare team, often including lifestyle changes like exercise, sleep, and mindfulness. The goal isn't to eliminate all anxiety but to make it manageable. Treatment restores function and improves quality of life. With the right support, people can reclaim their lives. Anxiety doesn't have to control you. Effective help is available. Let's return to our central question. So, is anxiety a real illness? Absolutely. When it becomes chronic, excessive, and impairs daily life, it's a clinical illness. This is backed by decades of scientific research. Anxiety disorders have a biological basis, clear symptoms, and established diagnostic criteria. They're not a sign of weakness. They're health conditions like diabetes or asthma. Brain imaging shows real differences in people with anxiety disorders. The suffering is real, emotionally and physically. Untreated anxiety can lead to chronic pain, heart problems, and weakened immunity. Denying its reality prevents people from seeking help and fuels stigma. We must treat anxiety disorders with the same seriousness as any other illness. People with anxiety deserve support, understanding, and access to care. Recognizing anxiety as a real illness is a step toward a healthier, more compassionate society. Let's make sure everyone gets the help they need. In summary, we've explored the difference between normal anxiety and clinical anxiety disorders. Normal anxiety is a healthy alarm system. A disorder is that system malfunctioning. Anxiety disorders cause real, measurable changes in the brain and body. Diagnosis requires careful assessment and ruling out other causes. Effective treatments, therapy and medication can make a huge difference. In crisis, immediate help is essential. The most important takeaway: anxiety disorders are real, common, and treatable. By educating ourselves, we fight stigma and create a safer environment for those who need help. If you or someone you know is struggling, remember, you're not alone, and help is available. Recognizing anxiety as a real illness opens the door to healing and recovery. Let's support each other with empathy and understanding. That's a fact worth sharing.